Good morning, everybody that is attending today. Let's go ahead, Sinead, and move the slides along and get ourselves started. So we have the fabulous team here. This has been a team for a while for our attendees. So I'm Joe DeLucchi. I head up Cal Insurance here in San Francisco. We have clients from coast to coast and work with them on their business, their school, their nonprofit, their real estate investment group, and we also work with successful families across the United States. And our fabulous team of ESM Insight, who many of our clients have gotten to know already, certainly through these webinars and certainly through personal touches. We have Anthony, we have Abe, and we have Sinead making up the great team of ESM today on this webinar. So, Sinead, I think we know the presentation housekeeping for those that have attended in the past. Let's continue to move forward on this big topic today. Okay, so last night when I was preparing with Sinead on the breakout of this, there is a slide at the end that talks about the question and answer breakdown from participants so far as these webinars have been rolling out. And so right now I think we know the questions you are going to ask. And you can put them in the Q&A. We will get to them throughout this presentation, but more likely toward the second half of it today. We know what's important to you guys from past webinars, and we got it, and we will get to it. So let's continue on. Okay, can you believe it, my friends? This is our 10th Cal and ESM webinar together. We started in March when the whole madness was getting started with the exposure control plan. Some of you guys have been with us for all 9 of them so far and the 10th today. And that's incredible. This has been a myriad of topics. This has been a myriad of changes, of confusion, and just rules seem to adjust day by day, week by week. But here we are. You guys have stuck with this, and we are going to continue to press out to you the most important information for employers as we continue through this pandemic journey. Let's continue, Sinead. I'll turn it over to you.
Yep, so we have some stats talking about our progression through the webinar series itself. Last year, we hosted 40 plus webinars. We had over 4,000 registered attendees, and then we talked for a good 2,400 presentation minutes, which basically is about 40 hours, like a whole work week, nonstop talking all about COVID-19 and the surrounding topics. So really, there was a lot going on last year, and we expect hopefully a quieter 2021, but we're going to continue on with our webinar series, so definitely stay tuned. So we have the agenda today. We're going to be going over Senate Bill 1159, Assembly Bill 685, and 3205. Lots of numbers going on there. This presentation itself is going to be given to you as a link. So you're going to have this as your toolkit for the beginning of 2021. So if you've been on some previous webinars going over those Senate bills and the Assembly bills and those regulations, you're going to be able to have everything condensed in this great toolkit, and we'll give you that link today. We're going to go over the FFCRA. We have some other resources. Of course, these webinars are full of resources, so we want to continue to give you those. Like Joe was saying, we have that great Q&A at the end, and then we also have some upcoming webinars coming up in the beginning of February that we'll discuss as well. So without further ado, I'm going to send it over to Anthony now to set the stage for this webinar.
Excellent. Thank you, Joe. Thank you, Sinead. Shout out to the Cal team. I see some of them on the webinar here. Appreciate all your help and the partnership. We're excited to continue to explore everything that this pandemic throws at us. What we've tried to do just with this webinar in particular, just so that everyone knows, that's why we have this setting the stage slide, is we try to curate as many questions based on client interactions, specific cases, FAQs, and then you can see down on the bottom right, we've got Cal-OSHA, FedOSHA, Department of Industrial Relations, local health department requirements. We're reviewing labor commissioner recommendations. We've got CDC, and now we've got the Equal Opportunity Commission and GINA, which is another one that's going to come into play, which is the Genetic Information Non-Disclosure Act. So we're trying to curate as much information as we possibly can so that we can deliver to you in a 1-hour webinar. So if we don't get to all of your questions, please don't hesitate to put them in the Q&A box or the chat box. We'll try to answer as many as we can, but if there's something more specific, we'll have to take that offline and we'll reach back out. So we're not going to focus on employment law today, although we kind of flirt with employment law, we flirt with human resource requirements, but really trying to stay focused on California, Cal-OSHA regulations. So Sinead, let's go to the next one. Let's have Abe talk about some statistics here throughout California.
Thanks, Anthony. Good morning, everybody. Welcome. I just wanted to add this slide just to give a brief snapshot and overview of what we went through in 2020. These are claims filed, and you can see a breakdown here for different areas in California. Obviously, LA was the hardest hit. 14%, you can see in the Bay Area, a lot of our clients are in that area, and you can see the breakdown by month. Now, we did a prior webinar addressing 1159, and during that webinar we had some slides similar to this showing the exposures up through the summer, and we really just saw it increasing every single month. There was a drop down in August, September, October, and really it kicked back up after the holidays. So overall, we've seen 93,000 claims, and this is going to mirror the normal population as well. As we saw spikes in population, we saw spikes in reported claims, which makes sense. So a lot of claims that hopefully we can turn the tide for January and February. And obviously, as Anthony mentioned, we have a vaccine in the pipeline. So hopefully we can see it level off a little bit. And as I mentioned, we've gone over, if you've been to our previous webinars with Cal, we've gone over 1159 and 685, but I think it's important just to put it back within this framework. We continue to have updated legislation and laws. I was talking to Anthony the other day, and some of our information from November was outdated. We call it the Stone Age, just a few months previous. So it's important to keep up to date, and you're in the right place now to do that. With regard to 1159, just as a brief refresher, this is the reporting requirement to the carrier. So it's a different framework that's an extension of the old executive order from Governor Newsom, basically saying that positive tests that come into your work site and employees that test positive are going to be presumed to be work related. The difference with 1159 is they have this outbreak framework. And basically what that means is they're giving you a little bit more leeway as an employer. So not every employee that comes on your site is automatically presumed to have a work related exposure. However, you need to report all of the positive tests for employees that are working on your site. And that is how they determine on the carrier side whether or not you have an outbreak. So you don't need to memorize, the whole outbreak criteria. It's listed here, 4 or more within 2 weeks if you have under 100 employees. But really, you just need to know that if you do have somebody come in with a positive test and they've tested within 2 weeks of working on your site, then you have an obligation triggered. And that's either going to be notifying the carrier of the case or reporting a claim if they're alleging a work-related exposure. So if someone comes to you and says, I tested positive for COVID and I believe I got it from work, you're just going to be filing a claim as normal. So nothing different than any other work-related exposure. There's a time requirement to get this in. You want to get this in as soon as possible just to get it to the claims administrator, but 3 days is the requirement. So really quick turnaround. You want to make sure you're getting all the information in. So just a quick recap on 1159. It's going to be reporting the positive tests that come in for employees that are working on site. So let's talk about the next slide here. I just wanted to highlight the difference between reporting a claim and alerting the carrier. There is some confusion about this. And like I mentioned, there's really one trigger. It's going to be somebody tests positive. What do you do with this positive test? What if you don't know if it's work related? Well, if we don't have them affirmatively saying they believe they have a work related exposure, we're just alerting the carrier. Some of the carriers have a form that you fill out. They call it 1159 form. Some of them have their online portal already updated, so you can just click a few buttons and let them know that you have another positive test. Remember, we're keeping their information confidential, so you're not reporting their name unless they're actually filing a claim. Like I said, if they're filing a claim, you're just filing it as normal. And you'll have these slides after the fact too, so you can go through it in further detail, but just for time, we'll go ahead and keep pushing forward. And again, the 685 notice requirement is something that also went into effect on January 1st. And this is another requirement for employers to notify their employees within 1 business day if they've come in contact with a qualified individual. And what does that mean? The easy way to think about it is basically somebody that has COVID that was working on your site and you're made aware of it. So an employee lets you know that they tested positive and they tested positive and they had been on your work site within the last couple of weeks. You want to send notice out to all your employees about a potential exposure. And there's various templates floating out there, various language you can use. It's really going to be tailored to your business, but you want to make sure that it's uniform. It's how you normally send out notices. You know, if they say that you can send out a text message, I can tell you with all the requirements for the notice, you're not going to be typing out, you know, a 3-page text message. So I would have this prepared if you haven't already, just in case you're not, just in case you have a COVID exposure, so that you're not doing this on the day of. I mean, this is just something that we've seen with COVID generally. You know, you have to do a little bit of homework, and you know, this whole team up on the dais here, we've been doing a lot of homework, and we can deliver it to you in an hour, but really it's going to take a little bit of time to disseminate and decide how your team is going to handle it when they do arise.
And the good news is that the template is in the ESM website. So if you're an Insight member, it is right there to be downloaded and modified to fit your particular need.
Yeah, and the key word is modified. I really encourage everybody, if you haven't already sat down and asked yourself the question as a business, what do I do if I have a COVID-19 exposure, to go ahead and do that. And as Joe mentioned, you can use some of the resources that are available to you. Just go ahead and edit. Make sure you're editing it to fit your own business. But with that being said, let me kick it over to Anthony to discuss 3205.
Oh, 3205, everybody's favorite new regulation. It is so complex and convoluted and poorly written. It's got everybody confused. And just as I'm watching chat, and while this is fresh on mind, Lisa, who put a question in about 5 or more employees, does that include temps? So yes, that does include temps. Think of it from a Cal-OSHA's perspective. If they are auditing your site, they're not going to know who's a temp or employee. And really the responsibility for maintaining a safe work site falls on the employer, and that includes everybody on that work site. However, if there's a COVID claim, that's going to be the temp agency's responsibility to manage that. So there is a fine line between that, but nonetheless, you're responsible for employees and temps. And then Jose, I'm going to talk about some of the definitions here in just a second. But for everybody on this call, just note that this new regulation was in effect as of November 30th, but there has been a grace period that's been provided to employers. And a grace period doesn't mean Cal-OSHA still can't come and audit and cite you for having failed any one of these 11 initiatives or requirements. But nonetheless, they will not issue monetary penalties until February 1st. So that gives you basically 10 days to get your ducks in a row. So you've got a couple of calls to action. We're going to try to call those out throughout this presentation. This 3205 regulation is really complex. It's convoluted. However, what I will say is most employers that we're working with are putting their best foot forward and making a good faith effort to implement this. And that's the best thing you can do, because in this scenario, there are so many moving parts to it. And we're going to talk about more of the regulations coming up here, but between AB 685 and the notice requirements, which is also part of 3205. You got 1159, the reporting and alerting requirements. And now you've got this monster, this 21-page regulation that you have to comply with. And you can see these 11 elements from communicating, identifying and evaluating correcting COVID-19 hazards, physical distancing, face coverings, engineering controls, which could be like the plexiglass barriers to prevent a direct sneeze or cough. You've got administrative controls, which is PTO, sick time, and other maybe staggering of shifts. Obviously, PPE, depending on your type of industry. Procedures to investigate any COVID-19 cases, training to employees. As Abe mentioned, when we look at things that were in November, we just feel like that's the Stone Age. So if you haven't provided refreshed training to employees recently, consider that stale. So you want to constantly provide communications and trainings and keep employees informed about your policies, as well as any changes that are coming down the pipeline, such as this webinar here. The exclusion and the return to work criteria, that goalpost continues to move. We're not going to talk too much about the pay requirements because that is a really complex subject. We actually have a webinar coming up with our legal partner, Littler, who's going to talk about quarantine pay just here in the next week or so. And then also just maintaining records. So if you're on prior webinars, you'll recall that we went through a case study where Cal-OSHA had sent a letter to one of our clients. This is the Cal client. And they had 5 days to respond to the COVID-19 allegations, which included physical distancing, communication, plexiglass barriers. And this was prior to 3205. And good for this client that they had all that documentation ready and we were able to respond with a thoughtful letter with supporting information within 5 days, which closed out the investigation without a further audit or penalty. So documentation is really critical in making sure that you have an affirmative defense against any potential OSHA allegation. And by the way, I think there's over 45,000 employee complaints to OSHA right now about their employer's lack of COVID-19 efforts. So it's really important that you have a good plan, you communicate that plan with the employees, get their participation in helping to identify exposures. But nonetheless, this 3205 regulation, I feel most employers are probably doing it. But as Joe mentioned, we have comprehensive exposure control plans in our Insight portal that already provide all of the guidance and the literature you need. Now you just need to continue to implement that on a monthly basis. So let's keep going here and talk about some of the details. So under 3205, we have these 4 core definitions, and these are really important because these help you define contact tracing, quarantine periods, and really just helping you give you a roadmap on what you need to do should you have a COVID-19 case. Now, COVID-19 case is defined with 3 elements. You have a positive COVID-19 test, the employee is subject to a COVID-19 isolation order by a local health department official, or somebody has died due to COVID-19. Now, the COVID-19 exposure, we're all pretty well versed in this now, being within 6 feet of a COVID-19 case for a cumulative total of 15 minutes or greater in any 24-hour period. We know all the symptoms. I'd say the most common symptom that we see now is the new loss of taste or smell. And then this last one, high-risk exposure period, for persons who develop COVID-19 symptoms from 2 days before they first develop symptoms until 10 days after. Now, let's take that into an example. So if you have an employee that comes in and says, I'm symptomatic, right? We don't know if it's COVID-19 yet. So now we've got a potential exposure. Under this, we need to look back 48 hours for contact tracing. Who is this person in contact with? Now, the potential exposure is a challenge because it's subjective. If you have a confirmed COVID case, now you've got definitive evidence on what you need to do. So we look back 48 hours. We saw that this person was working with these 5 individuals within the COVID-19 exposure. So we need to quarantine those individuals, get them tested on day 6. And then if they're asymptomatic or their symptoms have subsided by day 10, we can have them return to work. So these definitions really provide the framework when you have to deal with an exposure or a case on how you need to look back, identify those quarantined individuals or identify those potentially exposed individuals and then quarantine them. And I can tell you that it's been a financial hardship for some employers. We have one employer that we received an email yesterday that they have 10 new COVID cases. And so the ripple effect of that is pretty extensive because you got to do the contact tracing. You've got to have them quarantined. You've got to notify the carrier under 1159. We have to send out the 685 notice. And then we have to track to see if they got tested. And the good news about the executive order, which we'll talk about in a second, that rolled out December 14th, is that employers can now require a negative test for the employee to come back to work, which is great because in the original 3205 regulation, it said those potentially exposed employees have to quarantine and the employer has to provide testing at no cost. But later in the regulation, it said you can't use the negative test to determine if that employee can come back to work, which is totally contradictory. But now with the executive order, they've modified that. So we do have the ability to require a negative test to have that employee come back. So that's a good change in the regulation, although the regulation is still pretty complex and convoluted. So let's keep going here. I know we're going to be up on time, so I want to keep us rolling forward. So who needs to quarantine? We talked quickly about this. People who have been in close contact with someone who has COVID-19. Again, you've got that COVID-19 objective test. Somebody is tested positive. You've got definitive information that you can now act on. We had in our last webinar that somebody said, well, my employee's roommate was potentially exposed to COVID-19 case. And that's 2 degrees of separation. All of us are really exposed at some point because, hey, what do we say? It's like 1 in 10 Californians, that we estimate have been tested.
Yeah, last time I checked that, it was around 7-8%. So those are just the positive cases for people that have been tested. Some people are just quarantining and coming back to work after the fact. So probably a bigger number.
Yeah, and we've had challenges in that. Husband is sick at home with COVID, wife comes to work, all of a sudden gets symptoms, quarantines. First of all, the wife shouldn't have come to work because she was in close contact with a confirmed COVID case. So that shouldn't have happened to begin with. But since she came to work, she was asymptomatic. She started to develop symptoms. She quarantined, got tested, got a positive test. So the employer had to look back 48 hours and found out that there was 25 individuals she was in close contact with. They quarantined those 25 individuals, had them get tested on day 6. During that process, the clinic that provided that positive test to the wife came back and said, whoops, we made a mistake. It's actually negative. So we've got these individuals that are quarantined because we thought we were acting on objective data. But nonetheless, during that quarantine period of those 25 individuals, come to find out 3 more of them had tested positive for COVID and they were asymptomatic. So the ripple effect is it's never ending. It's really challenging for employers. And so Abe and I spend a lot of time, and Joe as well, going through specific decision tree analysis with employers on, if this happens, let's walk through the decisions that need to be made, the notices that need to go out, the quarantine periods, and then the return to work strategies. So each case has been mutually exclusive. They've all been a challenge, and nonetheless, we've got a framework that we can work within. We're going to show you one slide that has the whole timeline between ground zero and day 14. So we'll talk about that in a second. But you can see here just some of the close contacts and the quarantine periods because of that. So let's keep going. Okay, return to work criteria. So this is another good slide. So we encourage you to review this with your COVID task force or your safety committee, because when you do have somebody that's quarantined, when can they return to work? And here are the requirements. At least 24 hours have passed since a fever of 100 degrees or higher has resolved without the use of medication. The COVID-19 symptoms have improved. So that's pretty subjective. At least 10 days have passed since COVID-19 symptoms first appeared. And then for employees without symptoms, at least 10 days have passed since the COVID-19 case's first positive test, or if a licensed healthcare professional determines the person is no longer a COVID-19 case. That last one's tough because it's hard to get appointments with doctors right now. They're trying to keep everybody out of the hospitals and they're doing telehealth. So it's hard for a doctor to determine if they actually don't have the symptoms anymore. So the 10 days is really kind of the rule of thumb. We're going to quarantine individuals. Day 6, we're going to test them, which is the recommendation. The negative test comes back, then they can return to work on day 10. It's supposed to be day 11. We have some employers that are doing it on day 10, but nonetheless, they're asymptomatic, negative test. We feel comfortable bringing them back to work. And when I say feel comfortable, remember that you have an obligation to maintain a safe and healthy work site for employees. So at any point, if you feel that's compromised, or you have an employee that you feel might potentially infect others or poses a risk, a direct threat to others, you do have the right to keep that employee off of work until the foreseeable future. So let's keep going here. We talked a lot about 3205. Sinead is going to post some stuff on our that we have posted on our website. I think it's on Cal as well. But we dive really deep into 3205. We're just going to give you the highlights today. This is the executive order in 8420 that we talked about, where all asymptomatic close contacts within 6 feet of an infected person for a cumulative total of 15 minutes or more over a 24-hour period may discontinue quarantine after day 10 from the date of last exposure with or without testing. That's a really important nugget. With or without testing. That wasn't an option before, but now we do have the option to use a negative test to bring that employee back to work. Okay, let's go to the next one. This is just more confirmation from the CDC. So what we saw was the regulation rollout on November 30th, 3205, and then the CDC came out with a recommendation on quarantine periods and how that should be reduced to potentially 10 to 14 days. So 10 days with asymptomatic negative test. And so the Department of Industrial Relations, Cal-OSHA, went back and modified their 3205 regulation to be that new executive order that we saw. So more confirmation. As you can see, we're scouring every regulatory website just to make sure that we can give you the most accurate information. And again, this is changing weekly. So I don't think I said that in setting the stage slide, but this is information as of today. We'll see what happens tomorrow. We'll see what happens next week, but we'll try to keep you updated so that you can make informed decisions to run your business. COVID testing. Abe, let me throw it over to you.
Yeah, great. So Anthony went over a lot of the criteria for COVID testing generally in quarantine, but this is just a really rough framework that you can see here with regard to the employer's obligations. And one of the biggest changes with 3205 is just providing testing at no cost to your employees during their normal work hours. Now, some medical facilities have been charging a little bit more. Some have been giving it away for free. Really, this is a little bit of homework. If you don't know the local testing facilities, that's something I would take a look at. The best resource is the local health department. Typically, they have a whole list of facilities or on-site services that you can use just to get those tests done in a quick manner, and some of them are offered at no cost. So something to keep in mind. This particular slide is just outlining whether or not you have an outbreak or a major outbreak. There's some additional criteria. Just keep in mind that an outbreak is over a 2-week period. So if they want you to do something like repeat testing, as long as you're not getting additional positive tests, you're going to be done doing that in a couple weeks. Let's skip over to the employee side. And again, Anthony went over this. The gist of this is 10-day quarantine, right? Even if you're asymptomatic or you're symptomatic, the difference is you have to follow the return to work criteria, again, that Anthony went over. You want to make sure that employees aren't coming in with symptoms. Even though they hit the magic 10-day mark, you want to make sure that they're self-monitoring through the 14th day. So this is the framework for that. The top portion of this is if they do not have symptoms. For an employee, if they do have symptoms, obviously you're not going to have them come back if they're still experiencing symptoms at that 10th day. And in fact, they should start the 10 days from when they start experiencing symptoms. So that's the gist of this. But again, another good resource to be able to take a look at with your team. And with that, Anthony, you want to go over the OSHA criteria?
Yeah, it was interesting, Abe, as you were talking about that last slide. I was just thinking about how much this is really on the honor system, that the employee has to self-monitor. If they come back on day 10, they're asymptomatic, they literally have to self-monitor and be honest about any potential symptoms. So there is this honor code that's built into it, which makes it difficult. Some employees feel that they have to work.
It's made it really challenging, Anthony, in the sense that, if it's a salaried employee, then I think, we don't really run into issues, or I haven't seen it. It's more on the hourly employee side that's challenged the employers that we've worked with.
Yeah, it's a lot of the employers are hardwired to think that I need to go to work and bill my hours in order to get paid. Not maybe understanding the FFCRA or not understanding PTO. So there's an education component that's kind of an underlying current here that is never mentioned. So it's really about the education of your available benefits to the employee and ensuring that they understand it. Because the last thing you need is somebody who is symptomatic,
right,
thinks that they have to come into work. And how many cases have we seen from that?
Yeah.
So a lot of it's education, which again goes back into the honor system of, hey, if you're sick, stay at home. There's benefits for you.
Well, and this slide's so important here too about the claims to Cal-OSHA, because we get these questions pretty much every day now.
Yeah, and there's confusion because you've got this monster of a regulation and there's all of these requirements pushed on employers. And so employers feel like, well, if anything happens, I have to notify Cal-OSHA. And you'll recall, there's been 45, I think it's almost 50,000 employee complaints to Cal-OSHA, to OSHA in particular. Now, there is so many responses. OSHA is overwhelmed. We've talked about reporting to the local health department. We'll talk about that in a second. The local health department is overwhelmed. So chances of them getting back are slim, but make no mistake, they will take note and they don't forget. If there is a complaint, if there's a notification, it will be documented, and at some point they will follow up. They are not one to forgive and forget. They're one to punish and enslave, as I like to say. So this Cal-OSHA reporting requirements to COVID, here are the two rules. Inpatient hospitalizations, that's really a key term in this. So in order for it to be reportable, an inpatient hospitalization due to COVID-19 must occur within 24 hours of that exposure to COVID-19 at work. So if somebody is exposed, they're admitted to the hospital. And remember, admission to the hospital is not you went to the emergency room. The emergency room is the jumping off point. If they are released from the emergency room, it's not inpatient hospitalization. It's when they're actually admitted to the hospital, and then you have to notify OSHA. They're saying notify OSHA within 24 hours. There's confusion about, is it 8 hours or 24 hours? Here's the deal. As soon as you get as soon as you have an inpatient hospitalization, just know that you have to call Cal-OSHA. As soon as you get wind of it, it's better to make the phone call than not, because if OSHA finds out, and by the way, hospitals, they have protocols to contact Cal-OSHA if there is a known related worksite incident, not just COVID, but just in general, any type of serious injury, they'll call Cal-OSHA. So it is better that Cal-OSHA hears from you. I've made plenty of anonymous calls to Cal-OSHA to get clarification about specific situations. So you've got resources to help you through that process as well. The next one is fatalities. So in order to be reportable, a fatality due to COVID-19 must occur within 30 days of an exposure to COVID at work. So remember, this has got to be work related. And then the employer must report that fatality within 8 hours of knowledge that the employee has died because of a work-related COVID-19 case. So inpatient hospitalization, 24 hours from the work site exposure, fatalities related to COVID-19 within 30 hours. And you can see this is actually from FedOSHA, and Cal-OSHA has adopted that. So there's a lot of FAQs coming from the various OSHA bodies, from FedOSHA to Cal-OSHA to Oregon OSHA to Washington OSHA. But nonetheless, we're going to try to curate the most specific information so that you can make that decision. If you have any questions on this, feel free to reach out to us. We can help guide you through it. Let's talk about recording. So now we're into that OSHA 300 timeline. We've got to submit our OSHA 300 log to FedOSHA, or Cal-OSHA, but it goes to FedOSHA, by March 31st. So when do you record a COVID claim on your OSHA 300 log? Well, first you have to know that it's work related. And how do you know if it's work related? You've submitted the claim to the carrier and the carrier has accepted it. That's a really good threshold, that once that's breached, the carrier has accepted the claim. They haven't denied it. They've accepted the workers' comp claim to be COVID related at work. And remember, we go back to the 1159. If there's 4 or more cases at a work site, it's presumed work related. So in that scenario, you would be recording all 4 of those COVID cases on your OSHA 300 log. It has to be work related, and the best way to do that is that it's deemed work related by the insurance carrier. So if you haven't got your loss runs, reach out to Joe and team, get your workers' comp loss runs, see if any of those COVID cases are on those loss runs, and that's a good way to start updating your OSHA 300 log. So I'm just going to leave it at that because the rest of the criteria is really related to traditional OSHA 300 requirements. Excluding COVID cases. Now, as we talked about, excluding COVID cases means somebody has a COVID case, we shouldn't have them come into work. Now, we have to train the employees about symptoms, if they're sick, what their available sick leave, PTO, SDI options are. This goes back to the FFCRA, which we're going to briefly touch on today. The harder part is about the exposures. So as you can see, employers must exclude employees with COVID-19 exposure from the workplace for 10 days after that last known COVID-19 exposure to a COVID case. So recall the definitions that we went through, that close contact, 6 feet, 15 minutes, 24 hours. If an individual has a COVID-19 case, those 3 elements we defined, and other individuals are potentially exposed to that individual for that close contact period, we have to quarantine them for at least 10 days. And we can have them test on day 6, which is recommended. We don't have to have them test as well. They can come back on day 10 if they're asymptomatic, as we talked about, without a fever and no fever reducing medications. So it's kind of confusing. We're going to give you a slide here in just a second to give you some better timelines so you can see it in one snapshot. But nonetheless, excluding cases, just think of it, and Abe has a great way of saying this, that in the spirit of the law, if you have information about a potential exposure or a COVID-19 case, you need to act on it. You have a moral obligation to do that. And that includes quarantining, testing. But again, each one of these cases is unique. So if you have any questions, we can work through that decision tree analysis to help you get to the other side with the appropriate notifications going out. All right, this next one, we are going to be talking about outbreaks, reporting to the local health department. So to confuse you even more, we know that 4 COVID cases at a work site is presumed compensable under the new 1159 requirement. However, if we have 3 or more cases at a specific location within a 2-week period, then we have to notify the local health department within 48 hours. We have actually curated all of the 58 county local health department requirements. You can see we've got this link. We'll put it up here on our website. I think Sinead just put that. And so if you need a reference point, you can go there. We're continuing to update that. Alyssa on our team has been really just awesome in making sure that we keep that updated. Obviously, we're all in the purple tier. We're still trying to figure this out of when we're going to have some of the relief and be able to reopen again. But nonetheless, if you have 3 or more cases, you have to report it to the local health department within 48 hours. I can't tell you how many employers we've dealt with that have had to deal with this, and none of the local health departments respond. So the best thing to do is notify them in an email if you can, or just document when you made the phone call. Because again, we have the requirement. We want to be able to have our defense that if we do get audited, we can show that we've notified the local health department. Okay, let's go forward. I'm trying to monitor the chat and questions and see if anything comes in that we can address as well. And some of these we'll get to. FFCRA, Abe, do you want to talk quickly about this one?
Yeah, let me go over the FFCRA. And the reason I chose the FFCRA, there's obviously a variety of leave laws, your own internal sick pay or PTO benefits that may be applicable, obviously SDI as well. But the FFCRA did technically expire with a caveat. They did leave the option open for employers to extend it and still get those tax credits through the end of March. So if you recall that 3205 requires us to continue the seniority, the earnings, and all the other rights and benefits for an employee if they're otherwise able to work, but they're excluded from work. So somebody that's quarantined, for example. But we know that we also have the option to extend this or not. And when we talk to our HR partners, there's really no reason not to extend the FFCRA so you can get the tax benefits, especially if you're going to be paying anyway. So this is something that you'll want to take a look at, especially this resource that we have at the bottom here. Obviously, we don't have time to go through, nor are we the experts when it comes to benefits and leave laws, but this is an excellent resource to compare all the different leave laws, not only in California, but federally. So there's obviously the federal requirements, and then California also has usually more stringent requirements. So definitely something to take a look at. Just know that the FFCRA, there's limitations there. And if an employee used it previously in 2020, they wouldn't be eligible for it again this year. So something to keep in mind. And with that, we'll kick it back over to Sinead.
Okay, so we have some great additional resources. I've been putting some links in the chat, so definitely check those out. You can have them real time. We'll also be giving you this presentation in just a bit, and I'll go over those details in a moment. So this presentation itself will have this slide in here, and this is an awesome one. You can print it out. It's for your reporting timeline as a guide. And of course, every situation is different. We keep saying it depends. So really use this just as like a guide when it comes to certain situations, but no, it may fluctuate here and there. So it'll go over notice requirements, reporting, testing, which of course is kind of like that gray area, and then return to work timelines. So this is what I was talking about. This link I'm going to be putting in chat. So once I stop talking, I will put it in here for you to reference. We have this guide. So this entire presentation is going to be in this PDF link, and we are going to continue to update it. So as you know, tomorrow something new might come up. So we'll make sure throughout January to make those changes as we are doing our webinar this month on this topic. We also have this 3205 audit checklist. So for all of you with your exposure control plans, infectious disease protocols, whatever you'd like to call them, you're going to have to make some changes to adjust and reference the 3205 regulations that just came into play. So this is a great check sheet for you just to go through your plan, nice little gut check to make sure that you have everything there to be updated. And then of course, once you update it, you want to train the employees again on the new policies. So for Insight users, we have this in an editable version. We also have our exposure control plan, and it has all the changes already in there. So very easy to merge your documents and become up to date. Within Insight as well, we have a great learning plan. So this is something that's new that's also within Insight. And if you don't know what Insight is, it's a portal. It's a subscription portal that we have, and it is filled with resources. So we have a great training section that you can learn about all various subjects of how to manage your workers' comp and safety programs. So this Cal-OSHA 3205, it's a little bit longer than our normal training videos, but it's a good one, and it goes over everything in full detail so you know exactly how to react and make any changes regarding 3205 in your organization.
And I'm going to give just a quick plug for ESM Insight, the website there. It is so powerful. We have so many clients that have signed up to be a part of Insight. The resources, you're not going to get these resources anywhere else. And I know there's a slide about, joining Insight if you're not in Insight already later on. But it's just such a powerful tool, and our clients really have benefited from being a part of it. So Sinead, I know we have some question and answer coming up next here.
Yeah.
I want to just, because we're going through, and there were a few different questions I thought were important real quick here. And one was about a law requiring employers to give 10 paid days of sick leave. And this was a Cal-OSHA requirement for providing sick leave. And so is anybody familiar with this or have any thoughts on it?
I'm reading through this, Joe. One of the new laws that I thought was this one requires employers to give 10 paid days of sick leave. Yeah, that would relate back to the FFCRA. It's that 80 hours of sick leave.
Mm-hmm.
Cal-OSHA is requiring employers to quarantine those potential exposures or COVID cases for 10 to 14 days. So yes, in effect, they're actually managing or pushing those leave laws. So this is where Cal-OSHA has expanded their authority. And that happened with 685 and it happened with 3205. Oops, did we lose our screen? Okay, we're back.
Okay, you're back. And then there was another one here, and we've seen this one before, Anthony. The employee doesn't tell the employer that they're sick. They miss a couple of days of work and then send a positive test result thereafter. Is there any corrective action or can the employer reprimand the employees? And I think that might be touching a bit upon employment law, but do you have a general idea on that?
Well, I think if you, just taken from a Cal-OSHA perspective, you have a policy where you're complying with 3205, you've trained the employee and the employee violates that policy and that training, then yes, you can reprimand that employee. There can be a disciplinary action. But those first two steps are really critical because you can't discipline somebody you haven't trained. But if you've given them training, you've made it very clear they have a signature on a form that you've provided that training, and then they violate that, then absolutely you can reprimand them. Now, what happens after that? Is it a verbal? Is it a written? I'll give you an example. We have a large bakery that older brother is the supervisor, younger brother works on the line. younger brother says, older brother, I don't feel so good. I don't think I'm going to come in. Older brother says, get your butt in here. We're short on staff. Guess what? He's sick. Infects 5 other people on the line. Now that supervisor has been trained specifically on COVID regulations. If anybody's sick, you stay at home. So he got what they call a level 3 disciplinary action and 1 more infraction and he'll be terminated. So as long as you provide a training and you have signatures on a form and those employees understand it, then yes, absolutely, you can enforce and reprimand employees for violating those policies. Now you still have a COVID-19 test. So now it begs the question, is it work related? Do we need to report? Do we need to provide a DWC-1 claim form to the employee if they asked for it? Or is it just an exposure or a COVID case that they got from a barbecue? So then you'd have the 1159 reporting requirement where you have to report the claim to the carrier, keeping all the confidential information and keeping that employee's information confidential.
And then here's a final one, and this one's actually pretty interesting. I have not seen this question, but is there any responsibility a vendor has to their clients informing them of COVID infections and exposures? Like, for example, the vendor visits the client building, and you know, people are doing whatever in the client building. I have not seen any requirements around a vendor reporting. Have you?
I haven't. You go ahead, Abe.
Yeah, I was just gonna mention, you know, it reminds me of the 685 notice, which is basically the blanket notice to employees, but there is a little section in it that does include subcontractor employers. So if you have subcontractors, it implies that you're supposed to tell those employers so that they can give notice as necessary. And also any employee representatives, such as unions and attorneys. It doesn't specifically outline vendors.
Yeah, I haven't seen
again, right, but it might be a legal question. You know, it, like a lot of things in workers' comp, it seems to be, it depends, and erring on the side of caution is usually best. But nothing in the language of 685 mentions anything about vendors. If you define a vendor as a subcontractor, then it would include it.
Yeah, and I don't think that most do, but I get that. I get what you're saying.
Right.
Perhaps we go forward into the questions that we're most commonly seeing and start knocking these out here.
So sounds good. Question 1 is my voice. Let's hope it stays with us. Let's see.
Well,
Can an employer?
24-hour minutes of presentation.
I know.
It makes sense.
It's taken a toll. Let's see. Can an employer ask an employee who is physically coming into the workplace whether they have a family member who has COVID-19 or symptoms associated with COVID-19? Who would like to take this one?
Anthony, this is right up your alley, buddy.
Yeah, actually, Abe and I have been talking a lot about this one. So this is interesting in that, no, you cannot ask the employee if anyone in their family has COVID-19 or symptoms. And this goes back to GINA, the Genetic Information Non-Disclosure Act. However, employers can ask employees, have you been in close contact with any known COVID-19 case or anyone with symptoms? So it's all in the terminology. No, you can't ask about the family, but yes, you can ask if you've been in close contact. Now, the latter question really is more of a broad question, so it's not specific to the family. One thing that we're actually working with Joe on a mutual client right now is they have a question about when an employee returns to work. Anyone in your household, does anyone in your household have symptoms or has a known COVID-19 case? And so we had a good debate on, does household insinuate family? And so we're going to get some more clarification on that. But again, if you have a questionnaire where you're asking employees, does anyone in your family have COVID-19 or symptoms? You want to change that to say, have you been in close contact with anyone that has a COVID-19 case or COVID-19 symptoms?
Perfect.
And that's under the EEOC right there. If you can see that link, Sinead's going to post this. The Equal Employment Opportunity Commission. So many acronyms and so many regulations.
So many
But
numbers, so many letters.
Abe will attest to this. The EEOC has a great website with great FAQs that are really geared towards what employers can or can't do versus Cal-OSHA, which is really, you know, they've got their thumb on you and you shall do this and you will do this. The EEOC takes a better perspective from an employer's position, and they answer FAQs from employers in a really clear way. So encourage you to look at that EEOC FAQ for additional guidance, and we're combing through that, and that continues to be updated as well.
Perfect. So anything where you see a link on the bottom, just check the chat. I'll be putting those for you to reference, but then also remember, I'll be sending over the link for this presentation too, so you'll have everything with all the hyperlinks as well. So question 2, can an employer administer, here goes the voice, a COVID-19 test when evaluating an employee's initial or continued presence in the workplace?
Yeah, I can take that one. Really, the short answer is yes. And obviously, this gets into the territory of mandatory medical testing, and the ADA does have some certain restrictions on that. And really, the crux of it is whether or not it's job related and consistent with business necessity. And again, the EEOC did provide some guidance on this and said that employers administering testing that adhere with the CDC guidelines will meet the ADA's business necessity standard. So that means that you can, but you just have to make sure that you're doing it right. And doing it right means following CDC guidelines.
Thank you, Abe. Perfect. Okay, so question 3. This one is actually 3, 4, 5, and 6. There's a lot of questions here. So this will be a long one. Definitely jump on in if you have any answers to these, but we'll start with the first one. If an employee calls to advise a household member has tested positive, but the employee has not tested and has no plans to test, how should an employer respond?
Well, 10-day quarantine sounds applicable, Abe.
Yeah, I mean, degrees of separation matter, right? You don't want someone coming in that's been in close contact with somebody that has COVID. You know, as Anthony mentioned, there's kind of an honor system here in a lot of ways, but just making sure that, you know, your other employees are remaining safe. Again, erring on the side of caution is best. I will say that, you know, there are certain requirements with regard to the FFCRA and them seeking a medical diagnosis. Obviously, if they're going to be under a 10-day quarantine, you want them to test after the 6th day because there's an incubation period. You know, sometimes symptoms don't manifest right away. So the 10 days, whether or not the quarantine pay is applicable, we know under 3205, if an employee is otherwise available to work but excluded from work, you have to continue their earnings. You can do that from a variety of sources. It could be SDI, if you know, if that's applicable, FFCRA, and also, you know, since we deal with workers' compensation all the time, if somebody files a claim, their benefits may be covered by the work comp carrier. Let's say they've exhausted their sick leave benefits, then temporary disability may kick in. Of course, most of these cases, thankfully, we're seeing them quarantine for the recommended amount of time, and then they're back to work. You know, there's very few cases that are extended beyond that time.
Well, the second question here, Abe, is a really tricky one. I think it's a really tricky one. Coworker exposure notification under 685 and/or Cal-OSHA triggered. Well, this is a tricky. First of all, this implies this employee is actually working. It's not a remote employee. That's the first, you know,
Right.
First item here. Second item, let's take Cal-OSHA triggered. I don't think Cal-OSHA gets triggered at this point. Do you?
No, in fact, as I mentioned, the degrees of separation really matter, right? So we don't have any information to indicate this person was even working on site.
Mm-hmm.
So as you mentioned, you know, if they're just working from home, we're not really concerned with it. Or if they were able to catch it before they even came on site, there's no notice requirement triggered. Because remember,
so we don't need to worry about 685 nor Cal-OSHA with the way this is playing out here.
Right. So if they did come on site and then they ended up inpatient hospitalized, for example, then we would have to be worried about it. But none of the triggers really are applicable here. And obviously there are exceptions if, you know, if there's some information that we're not aware of in this fact pattern. Anthony, do you want to touch on the 300 log?
Yeah, so again, because we, as I mentioned, we don't have all the information, so we don't know if it's actually work related. Again, we're not going to record that on the OSHA 300 log. We're not going to be calling the local health department or Cal-OSHA, obviously because it's not an outbreak, but we wouldn't be contacting, or we wouldn't have any recording or reporting requirement to Cal-OSHA because, again, we don't know if it's work related. And 2, we don't have a positive test by the employee. So that's the tricky part too about the employee has no plans to test. Now, in reviewing the EEOC, employers can require employees to get tested because employers need to be able to manage a safe and healthy work site. And how do you do that if you have somebody that's questionable? So it's a very delicate situation. This is why we talk a lot about through this webinar about you have to kind of work through all of the variables so that we can understand the entire picture and then make an informed decision on what to do next. Now, with this case, the employee has not tested, has no plans to test. They're going to quarantine for 10 days, right? And at day 10, if they don't have any symptoms, they don't have a fever, then technically they can return to work. It's a matter of comfort from the employer side. Do you feel comfortable bringing this employee back to work, or do they pose a direct threat to others because of a potential infection? That's a tricky one. But again, Cal-OSHA, there's really no requirement because we don't have a work-related incident yet.
Perfect. Thank you.
So it makes this so much fun.
Yeah.
There's so many
So
different rabbit holes you can go
confusing,
down here. I mean,
right.
just this one question alone, just trying to unpack it. All right,
Right.
so we got question 4, Sinead.
So I don't have the next question. Do you want to, let's see, so Anthony, I want to say the next one. I have webinars coming up next, but
we talked about question 4, but we're going to kick that to Littler because it was all about quarantine pay and FFCRA. And
Got it. And then there was one other item that just quickly came through. Our employers newly required to pay for quarantine time through one of the new laws. And the person goes on to say, I believe yes, but would like to know the parameters if the state's likely to boot that piece of law. I mean, I don't know about that. But
yeah,
our employers newly required to pay for quarantine time through one of these new laws.
Well, they have to continue the pay and benefits for employees that would otherwise be able to work but are quarantined, right? The issue is it's hard to give a blanket answer because different leave laws apply to different companies and different sizes. So I really encourage employers to take a look at that side-by-side comparison of all the different leave laws, including the ones that which are included in the resource, but including the ones that expired on December 31st. There's some exceptions to that, but generally, you know, if they're off work and it's not work related, they may not qualify for certain benefits or may not qualify for some of your internal sick leave, for example. And in that case, they may have to apply for SDI or unemployment insurance. It really just depends on the specific case.
Yeah, and there's the terminology of able and available to work. And if that's the case, then those seniority, those pay, those benefits are extended. Now, the question is, what does it mean to be unavailable to work? Is it the symptoms are precluding them? Are they on a ventilator? Right. So there's various scenarios within that FFCRA and that paid quarantine or paid extension applies. And this is where, as we talked about at the beginning, you know, we're not employment law attorneys, and even employment law attorneys, you know, are confused with this, as well as Abe and I have found out. So we're going to have Littler, in fact, Sinead, why don't we run to the next webinars and we can get people links so that they can sign up, because we're going to try to answer these questions in more detail.
So just like we were saying, this presentation, I put the link in chat, it's ever changing just from yesterday to today. Of course, we're constantly adjusting the slides, just like those question slides, to make sure that when we answer them, we're giving you the most up-to-date and you know, factual information. And in order to be the subject matter experts, we have to have some great subject matter friends. So this is that presentation that Anthony was talking about. This webinar is coming up. February 3rd is around the corner. And so if you wanted to sign up, you'll see the register here. It's going to be a hyperlink in all of these PDF presentations that we are sharing with you. So definitely check this one out. We'll be going through quarantining and benefits, as well as vaccinations, which is a really hot topic and it's very controversial. So we'll be going through all the ins and outs with our law partners at Littler.
Sinead, real quick, we have changed some of this format just as of yesterday, so we haven't had a chance to update the slides, but it's going to be about employee vaccination. What can employers require employee vaccinations and quarantine pay? Because as we can just see in this webinar in particular, and every other webinar we've hosted, the FFCRA and the quarantine pay is so confusing. So we're going to try to get some more light shine on that from our employment law partners at Littler.
Yeah, so it might change tomorrow too. So just know, keep an eye on this link, keep referencing it. We are constantly going to be changing and pivoting so that we can give you the most up-to-date info. We have another one after our Littler webinar. This one has moved. We referenced it in the previous webinar, but it's now going to be February 4th. This is with Hector Alvarez. So we are going to be talking about workplace crisis intervention. So of course, we're getting back to work slow by slow, depending on what county you're in. So we want to make sure that everyone's mental wellness is top notch when it comes to your employees. So this is a great one. Definitely you can see the register here button on there, which is going to be in your PDFs. It's a hyperlink and you can register to join this webinar as well. We talked a lot about Insight. So the Insight itself, the subscription service, which is that portal that's going to give you access to all of the resources, every piece of framework that you would need to manage your workers' comp and safety programs is within the portal itself. I know talking with clients just to get an exposure control plan, as well as any other of the policies that we have within Insight, it's far more than this price. So it's a great deal that we have right now. It's a discount for our Cal clients, $860 per year. If you have any questions, definitely reach out. There's a great survey that's going to come through at the end of this webinar. So as soon as we close out, you'll receive it. It's 4 questions. I promise it'll take you less than 2 minutes. But there's a great question. It's question number 4, which is open-ended, and it's there for you to let us know what type of webinar and subjects you want to learn about next. So it's a chance for you to say, yes, I'd like to hear more about Insight, but then also let us know your suggestions of what types of webinars you want to hear in 2021. So with that, I'm going to say thank you to everyone. Of course, 2020 was a year and a half. It felt like it was a little bit more. So 2021, we are going to be moving forward. We're going to continue these webinars to give you great information to get back to work and help make your organization safer. And know that we're here to help. So reach out to us with any questions that you might have. And with that, I'm going to turn it over to you, Joe, to close out.
Well, no, I just want to thank everybody for their participation, for their questions. We packed a lot in a very short period of time, so we tried to get to everybody with the questions there. So we are going to have this recorded. We're going to send this out as well, and thank you. Take care. Have a great rest of your day.